Hi, my name is Erica Nisla, and I'm going to be talking to you about my policy brief project for a health policy class for a nurse practitioner. So specifically, I want to amend Wisconsin Senate Bill 202 and the Servability Act 125.015. They kind of go together. The Bill 202 prohibits adults to knowingly serve alcohol to underage people and prohibit consumption of alcoholic beverages on any premises. So the Servability Act basically is dealing with who is serving alcohol and how it is distributed, basically within Wisconsin. So the Wisconsin Senate Bill 202 will prohibit adults to serve alcohol to minors on any premises. It was introduced and signed in 2017 by several of Wisconsin senators and representatives, which you can read here. I won't go through the list. And then the audience was the Committee on Judicial and Public Safety, and many of those who signed the bill were also on that committee. So the intent is to amend the Senate bill, and let's all remember the legal drinking age is 21 years of age. The Wisconsin State Revenue states, by definition, an underage person who is someone below 21 years of age. So the issue here in Wisconsin is that you have 18-year-old serving alcohol to people who are of legal drinking age who are 21. So there's several factors that go into that, like how does an 18-year-old know when they're over serving if they've never been exposed to alcohol? Or are they appropriately carding people? Or are they drinking on the job, which gives them access to alcohol? And so to go through some of the statistics, approximately 5,000 people die a year from underage drinking. 33% of Wisconsin underage drinking between ages of 18 to 20. So those are your ages who are serving your alcohol. 7% of drunk drivers in 2015 were under the age of 21. Many young people in the range from 15 to 19 who are exposed to alcohol at an early age are more likely to binge drink and participate in underage drinking. And then drinking causes depression, memory issues, poor judgment, and several other health issues, but it can affect hormones of people who are underage. 1 million high school students engage in underage drinking, and it's a precursor to using other drugs such as heroin, cocaine, or marijuana. Some of the background and history relating to this topic and why we should think about amending it. Many bartenders consume significant amounts of alcohol while they're working. If you have an intoxicated server, their judgment's impaired, so they don't know when they are over-serving another person. Several taverns and restaurants in Wisconsin don't have drinking policies, so you can have your server having a drink with the patrons, and that's perfectly acceptable at some establishments. There's only a couple counties who have a sober serving policy where their server has to be sober, but very few have that policy. And then some other interesting facts are in 3 states require you to be 21. Only 3 states require you to be 21. 37 states allow you to be 18, and there's 1 state that still allows you to serve alcohol when you're 17. So by increasing the bartender serving age, you decrease underage drinking and possibly decrease driving under the influence. It also will reduce potential health risks that are involved with drinking and driving or other injuries caused by alcohol. So Wisconsin Senate Bill 202 and Servability Act 125.015, the summary and intent is to amend statutes relating to allowing underage bartenders and servers to be able to sell alcoholic beverages to underage patrons or any patrons. The bill will also strengthen the sober server policies in bars and restaurants and will reduce underage drinking. It will make it mandatory in all premises where nobody under 21 can serve alcohol to anybody. The intent of the bill is to raise the servability age to the legal drinking age of the state, which is 21, and not allow alcohol consumption to minors, especially ones who are serving the alcohol. Some of the unintended consequences of the bill: it will force some bartenders to find a new job. Some bartenders use this as a livelihood for their money if they are students. Tavern leagues will need to be responsible for hiring bartenders and servers who are of legal drinking age and therefore would not be able to hire anyone under 21. Bars and restaurants could receive fines from law enforcement if they knew that their servers were drinking under the age and possibly over-serving to other patrons. And then some other stakeholders might feel like there's not enough data to support underage drinking while they were on the job. So fiscal estimates in Wisconsin: underage drinking costs to Wisconsin is $1 billion in 1 year. This includes medical, hospital treatment, work loss, and treatment programs related to alcohol and underage drinking. So the average cost to implement this program, I couldn't find any research specifically towards bartenders, servers who are underage, but you would assume that the change would be very low to just make the legal serving age 21, and it wouldn't be a very big cost for the tavern leagues or any of the restaurants because they would just have to put 21 or older into their hiring process and implement some sober serving policies into their premises, which would probably be at very low cost for them. Some of the stakeholders for this: the Wisconsin Department of Transportation. They would keep the statistics of underage drinking, driving offenses, and injuries caused by alcohol of people who are under the legal drinking age. The Wisconsin Department of Revenue. They would be involved in the alcohol, beverage, and tobacco laws for retailers. They would enforce new policy changes to make all bars and restaurants and all other establishments to abide by servers being of legal drinking age. The Tavern Leagues of Wisconsin would create policies to strengthen sober rules in place for their establishment, which would decrease their risk for underage drinking fines or over-serving fines. The National Institute of Health would be involved because it provides health information and statistics at a national level. They would be important on conducting research as to how many underage bartenders and drinkers there are and how it affects their health. Law enforcement would be involved because they would be enforcing the legal drinking age and legal serving ages. Legislators would be involved because they're creating the policies on the Servability Act in Wisconsin. And then local organizations and hospitals are involved because they can also add to the alcohol-related death or injury statistics. It is my recommendation as a master's level nursing student in the Family Nurse Practitioner program to recommend amending the Servability Act 125.015 for Wisconsin and in conjunction with amending Bill 202. Amending the Servability Act will change the legal serving age to the same age as the state's legal drinking age. And this will support the Bill 202, which deals with serving alcohol to minors and decreasing underage drinking at establishments. It is a loophole in the system, and it allows underage bartenders or servers to be exposed to alcohol and drinking underage. It also increases the chances of underage servers to overserve patrons. These servers are exposed to drinking at an earlier age, and this amendment would also benefit the bars and restaurants because they would not be liable for over-serving patrons, and they would have stricter sober server policies and would help decrease exposure to underage drinking, other underage health-related problems related to drinking, and alcohol-related traffic violations related to underage drinking. This is a list of my references. Thank you for listening.